Okay, well, good morning, everyone. We might get started. It's 9:01. I hope you can all hear me and you're doing well this morning for a Monday morning. So, sorry, I'll just make sure the chat's working as well. There we go. So welcome everyone, and thank you all for joining us. Sending a warm welcome to everyone here with us today. My name is Amy Dellett and I work for QCOS, the Queensland Council of Social Service. I'm the Senior Data Analyst in the Research and Policy team at QCOS. So some of you may already know me as I coordinate another network at QCOS, which is the Research and Evaluation Network. So today we're here for a different purpose. We're here for the very first webinar. We're launching a new network and a new webinar series. So we're here today to talk about the Domestic and Family Violence, Sexual Violence or DFSV Data Insights Initiative and the new DFSV Data Insights Network and what that all means for the DFSV services sector in Queensland and the community services sector more broadly. So we're also here to kick off the webinar series with a wonderful guest speaker with us today, Dr. Ruth Knight. So just for the agenda today, I'll give an overview of the background and context to this work and then provide some more details around the DFSV Data Insights Initiative and the network. That should take about 20 minutes and we'll look at the terms of reference, the purpose of the network and our approach, the guiding values and benefits of participating, expected code of conduct with the network, as well as governance. And we'll also talk a little bit about evaluation too. I'll then hand over to our guest speaker for today's event, Dr. Ruth Knight, who's here to give the presentation and talk us through what is the value of data and how it can improve practice. I'll also be discussing the plan for the network and talk about some resources that we'll have available to the DFSV services sector. There should be some time at the end also to take some questions after we get through all of the content for today. So just a couple of housekeeping things to note. By default, you will be on mute, but your camera will be turned on. This isn't to silence your voice in any way, rather it's just to ensure that the session goes smoothly and that our guest speaker can focus on the content for the webinar rather than background noise as distraction. So like I said, this session will be recorded. If you don't want your face shown in the recording, please feel free to turn your camera off. However, the Q&A component at the end of the webinar will not be recorded. If during Q&A you'd like to ask a question, you can write the question in the chat. The other option is you can put up your hand using the raise your hand emoji and then take yourself off mute to ask the question. If we do run out of time with the Q&A, we can connect with you individually after the session. Please just pop your question in the chat pane and I'll also share our contact details for the network in the slides that follow. So just as way of introduction, I would like you all to share, would love you all to share if you feel comfortable in doing so in the chat where who you are and where you're joining us from today. Where you work, and we'd encourage you to acknowledge country where you are today in the chat as well. This would be really great, particularly I guess for our first webinar, so we can have a better understanding of who's online today and who's connecting with the network. So I've already introduced myself. I also have a QCOS colleague online today, Tawiro, who's the Manager for Research and Evaluation at QCOS. As well, we have Dr. Ruth Knight. So yeah, welcome everyone. Thank you again for joining us. I'd also like to begin by acknowledging the traditional owners and custodians of this land, the oldest continuing cultures in human history, continuing cultures, diverse languages and knowledge holders. QCOS is committed to reconciliation for self-determination of First Nations people. We acknowledge Aboriginal and Torres Strait Islander peoples as the original inhabitants of Australia and recognise and celebrate the many unique cultures as part of the cultural heritage of all Australians. We pay respect to the elders of these lands, past and present. I'm joining you from the lands of the Yagara and Turrbal people, from which I work and live here in Meanjin in Brisbane. And I'd also like to acknowledge and pay my respects to all First Nations colleagues joining us online today. So QCOS is the peak body for the social service sector. Our vision is to achieve equality, opportunity and wellbeing for all Queenslanders. So in April 2024, the Queensland Government announced QCOS as the state's interim DFV peak body for the domestic and family violence sector. So over the next 2 to 3 years, QCOS will be establishing an independent DFV peak body, a member-based organisation representing domestic and family violence services in Queensland. So just noting that in relation to the DFV peak body, this initiative and the DFSV Data Insights Network is funded separately to the DFV peak. This initiative is being led by QCOS as the peak body for the social service sector. This initiative also extends to sexual violence services as well. So for inquiries related to the DFV peak body, please contact DV peaks at qcos.org.au, and I'll just share that in the chat as well. So before we start, I'd also like to take a moment to acknowledge the terrible impact of domestic, family and sexual violence on individuals, families and communities, and the strength and resilience of the children and adults who have and are still experiencing violence. We pay respects to those who did not survive and to their family members and friends. QCOS would like to acknowledge and celebrate the work, strength and courage of the domestic, family and sexual violence sector, the outcomes that have already been achieved, and to all those who are part of this journey now. So as a network, these discussions will focus on domestic, family and sexual violence. If you do find anything distressing from today's content, we encourage you to please take the steps necessary to exercise your right to safety and ensure your own well-being first and foremost. So as mentioned, the presentation component of this webinar will be recorded. So if you do need to take some time to step away, you're more than welcome to come back and watch the session at a later time. If you do find yourself in need of support, please reach out to your EAP, supervisor or support service such as the ones that we've listed in the slides. So as I mentioned, today we're sharing some background information on the DFSV Data Insights Initiative and an overview of the DFSV Data Insights Network. So firstly, some background to this work. So the DFSV Data Insights Program was established in 2022 by the Department of Justice and Attorney General to address the experiences of ongoing challenges regarding timely access to useful and meaningful DFSV data. The department identified that access to appropriate and timely information is an important enabler for recognising, preventing and responding effectively to DFSV. Data is instrumental in improving the safety of women and their children and ensuring effective return on government investment. So the requirement to strengthen data culture and capability was also identified by several reviews and strategies, including under recommendation 86 of the Women's Safety and Justice Task Force, Hear Her Voice Report 1, the DFSV Data Insights Program Current State Analysis Report, and recent reports of national DFSV strategic work led by the Commonwealth. The Data Insights Roadmap is a 6-point plan that outlines the work required to position the DFSV service system, including government agencies and funded service providers, to collect and analyse data and trends moving forward. More recently, the Queensland Women's Safety and Justice Task Force highlighted the central role that data plays in coordinated responses to DFSV. In response to recommendations 85 and 86 from the task force first report and recommendation 184 of the second report, the DFSV Data Insights Program expanded to support the whole of government DFSV monitoring and evaluation framework to measure and monitor outcomes achieved across the DFSV service system. So just for reference, I'll share some of the links to these resources in the chat pane for you now as well. So as I mentioned, the department established the Data Insights Roadmap for the DFSV funded services sector, and the roadmap addresses 6 areas of work that will need to be undertaken to better position the sector and department to collect and analyse data trends. So the 6 interconnected streams of work are establishing foundational elements, standardising data for reporting, building sector data culture and capability, collecting and presenting data, connecting data to drive insights and support service delivery, accessing data to inform service responses for women and children. And so the established activities supports the DFSV service system to gather more relevant data to inform service delivery responses and departmental reporting. So again, separately from the peak, the department has funded QCOS to deliver activities that aim to build and strengthen the data capability for the DFSV services staff and DFSV service organisations, and internally as well within the Department of Women's Safety and Victims and Community Support. So the DFSV Data Insights Network will provide an opportunity for collaboration and knowledge sharing in the area of DFSV data, with the aim of more effectively utilising community sector resources and government developed resources to promote improved outcomes and data capability across the DFSV services sector. So the next slides are all about the establishment of the DFSV Data Insights Network, and these details are also going to be included in the terms of reference, which will be shared after the webinar. So really the Data Insights Network aligns with the broader Data Insights roadmap. And so the purpose of the network is to improve the data maturity of the DFSV service sector to ensure there is an understanding of and commitment to the benefits of adopting an insights-driven approach. Ensure sector uptake of data insights roadmap resources and that they're monitored and supported across the DFSV service sector, and contribute to service responses that are underpinned by integration, robust information and evidence-based practice. And then also enable the DFSV service sector to be positioned to enact people, process and system changes as required through business readiness support. So what are the benefits of participating? So participating in the network really offers several benefits that can be to ensure and build on and contribute to the evidence base to measure and monitor outcomes achieved across the DFSV service system, outcomes for victims and their children and persons using violence. Strengthen DFSV services understanding and data capability across the data lifecycle. Build an awareness and capability around data quality dimensions such as accuracy, completeness, timeliness, availability, consistency, and validity. Enhance knowledge around data collection standards that relate to the DFSV services sector, and to establish a shared language to enhance collaborative practice within and across DFSV services. Identify data collection gaps and barriers to assist the DFSV service system, including government agencies, to understand their current capabilities and limitations. And collectively consider data governance and data strategy activities that enhance and support people, process and systems. Also share data insights with a focus around information sharing, resources, reflection and learning. And lastly, to identify and discuss data challenges and opportunities arising in the DFSV services sector and provide feedback to the department and relevant stakeholders on progress. So looking at the approach, the network will adopt a strengths-based participatory focus that leverages, draws on and values current knowledge, expertise and capabilities that exist within the sector. So monthly webinars will offer guest speakers and discussion on a range of topics to strengthen and uplift data capability in the DFSV services sector, while access to peers and experts will provide a community of knowledge and experience to draw on for everyday support. So the network will foster and facilitate two-way learning where the DFSV services can share current practices and processes on how they use data to improve outcomes for their clients, as well as the network sharing resources and data capability, uplift strategies, ideas and tips back to DFSV services to improve their practice. So in terms of membership, membership of the DFSV Data Insights Network is at the discretion of QCOS. New members will be admitted at any time subject to approval. QCOS will actively seek to encourage engagement in network activities across a diverse range of members and stakeholders, including representation from many service types across the DFSV service sector. So membership is encouraged for all DFSV service sector staff, and this encompasses staff who collate, analyse, or report on data within their organisations. Department staff within women's safety and victims and community support will also be invited to participate in DFSV Data Insights Network webinars, and their attendance will support and uplift their own data capability. Network webinars recordings will be made publicly available, and we encourage members to share the webinars with their organisations and with their colleagues as well. So just quickly looking at who are the members and stakeholders in scope for this initiative. So obviously I've covered QCOS and our role. The DFSV services sector, really just looking at some definitions here. So this refers to non-government organisations funded by women's safety and violence prevention, contributing to Queensland's domestic, family and sexual violence response. So there are over 100 funded DFSV services in Queensland. And then also the Department of Justice and Attorney General. So this refers to the Women's Safety and Violence Prevention and the Investment and Commissioning branches. So INC branch is responsible for program design and management, investment decisions that inform contract management, including strategic and program reviews and evaluations. The WSVP branch is responsible for contract management functions of the DFSV service sector. It manages the integrated service response, including oversight of HRTs and the broader service system response. And this branch also leads activities that build the capability and capacity of the DFSV service sector. So stakeholders outside of the scope for the DFSV Data Insights initiative, but may be impacted because of the initiative more broadly. So there's the DFSV service system, and this includes other government agencies that have a responsibility around DFSV. So for example, Queensland Police Service, courts and Queensland Health. We have the community services sector more broadly. So Queensland community services sector includes, but also extends beyond the DFSV service system. And also the DFSV community. So the community includes, but is not limited to people who experience, witness or use violence and the broader public impacted by DFSV. So this includes victims and their children and their families and kin affected by the violence and persons using violence that are accessing community services for supports. So again, who can participate? So the DFSV services work across complex project programs, service delivery areas and systems. The network participation is open to DFSV DJAG funded services staff across Queensland. And so we've listed some of the service types that may be interested in participating. So for example, Aboriginal and Torres Strait Islander services, case management, centre-based support, children's domestic violence counselling, court-based services, domestic violence counselling, and the others listed on the screen there. So participation isn't limited to those who can attend every month. Organisations also outside of this list are welcome to participate. For example, community service providers with an interest in learning more about DFSV data are also welcome to participate. So in terms of code of conduct, the network is a diverse group of representatives from many service types. And so we come together to learn and share knowledge and collaborate on strengthening the data capability across the DFSV services sector. So to support this, the agreed code of conduct for attending the network activities are valuing and upholding respect, integrity and confidentiality, listening to and understanding and being solution orientated, respectfully and constructively challenging ideas or areas of focus, being open to new ideas and offering different perspectives, being open to and championing change, and remaining client-centric and long-term focused, and also a willingness to share information, resources and reflections. And so we've put some guiding values for the network as well, including collaboration, transparency, a safe place to ask difficult questions, confidentiality, peer support, and innovation. So like I mentioned, webinars will be held monthly throughout the year or otherwise determined by QCOS and the availability of our guest speakers. So to facilitate access to and information sharing of resources, webinars will be recorded with permission obtained prior to each webinar. Webinars will also be uploaded to a DFSV Data Insights page on Community Door, which I'll go through later in the slides. And so where webinars contain sensitive information, the recording of the webinar may be determined as sensitive or private, or if it includes personal or identifying information, the decision may be made not to make the recording publicly available, and considerations are also made around sharing copyright material as well. So in terms of the terms of reference, they're effective from the 1st of September 2024, and a review process will occur annually. And the review will be conducted by QCOS, and the updated terms of reference circulated to the network members for comment at the following webinar. So in terms of responsibilities of QCOS, they will be to coordinate the network and provide secretariat support as chair and to the wider membership. So including inviting DFSV services to participate in the network, setting webinar agendas and focus topics, recording of the webinars where prior consent is gained by participants, and moderating online conversations and messages, and monitoring where appropriate, taking responsibility for action items, and follow up questions or actions as relevant and required to clarify any concerns or confusion. In terms of expectations of members, they are to declare any conflict of interest, also share the experiences and evidence base of their organisation, and communicate the challenges and opportunities impacting the wider sector, not solely their organisation, as well as being open and available to participate in data uplift activities and sharing feedback about their experiences and data when they wish to do so. And also look to promote the benefits of data insights in everyday practice. So in terms of an evaluation on an annual basis, as with all of our networks, an anonymous survey will be circulated to all participants, participating members, to seek feedback on how QCOS can continuously improve the network, as well as will seek input on the strategic direction of the network for the following year. So that is the bulk majority of the logistics and the practicalities of the network. I know that's a lot to cover, and like I mentioned, a lot of that content is covered in the terms of reference, which we will share. And so I'd like to move now on to the guest speaker component for today's webinar on what is the value of data and how it can improve practice. So it's my absolute pleasure to introduce our guest speaker for today's event, Dr. Ruth Knight. I had the pleasure of first connecting with Ruth a few years ago now. Ruth has worked in the community services sector for 25 years and is passionate about research and evaluation. She was a previous guest speaker for our Research and Evaluation Network, speaking to our most popular topic to date for the network, which was on building a data-driven culture. So Ruth has some new content for us to share with us today. I'm very excited to have her here with us to learn more about the value of data and how it can improve practice. So I will now stop sharing my screen and I'll hand it over to Ruth. Thank you, welcome, and so much. Thank you so much for joining us. It's really lovely to have you here with us today, Ruth. I'll hand it over to you.
Thanks so much. It's so good to be here, and I feel, very honoured to be as part of this new network. It's just really exciting to hear everything that you're saying, Amy. And I am really pleased to see some people I know in the chat and some people I don't know. Hello, everybody. I'm just really excited to get to know you over the next few minutes, but also just to get this network kicked off and really starting to actually think about how do we learn and share and improve what we do through coming together and really discussing important topics. So thank you, Amy, for the opportunity. So yes, my name is Ruth Knight, and I have been working in the sector for 25, 30 years now, working mainly in the space of homelessness and child protection, but obviously that includes a lot of the other issues that contribute to homelessness and those sorts of issues. So one of the things that has always been a really important topic for me is, you know, how do we improve what we're doing? How do we get better outcomes? And that has, you know, journeyed me, I suppose, this whole idea of what is data and how do we use data to improve our practice. So I've really seen over those years that data is very important, but there's a lot to learn and there's a lot to think about and reflect on as we go down this journey. And you've already heard the word data about 50 times, I think, from Amy in the last few minutes. And so I'm really, really keen to know what journey you're on and what you're thinking about data in your own organisations, but also as a sector. So the big question for me then is really, what is the value of data? And that's what I want to share with you a little bit today. Let's see if my slides change. Yes. So I thought that today we would really think about maybe three major questions, or maybe three major thoughts and reflections. Really, what is data, and how can we use data to improve practice? What is this term that is being used called data-driven culture? What does that mean, and how do we start to embed it within our own organisations? And then what are the opportunities for us as obviously individuals, but as organisations and as a sector? How do we make sure that we're using data wisely and valuably to ourselves and obviously the people that we work with as well? How do we make sure that we're using data widely? So today I really want to get the conversation going. Please feel free to use the chat. And Amy, can I just check? I don't think the chat is recorded, is it? So it's
no, the chat's not recorded.
Yeah, so I want people to feel free to put some stuff in the chat, but it helps me think about what you're thinking about as we're chatting, but it also that sort of share and reflect when you use the chat or when you have a question to ask. It really helps everybody learn. So please feel free to use the chat. And as I go through today, I've got a few questions for you, so I'm hoping that you'll be able to use the chat to answer those questions and really engage in what we're talking about this morning. I don't want it to be just me telling you my story. I really want to hear what your story is as well. And at the end, I thought that I will ask you what your key learnings or takeaways are from this conversation. And that is also, I found, a really good way to help other people learn and reflect themselves. So maybe hopefully you've got a pen and paper ready, or you're taking some notes, and we will share the slides afterwards, of course, and the recording. But please feel free at the end to, tell us what you get out of this, so that can help Amy moving forward. All right, is everybody ready to go? Can everybody put a 1 in the chat? And then I know that we're fantastic. Thank you. Thank you. All right, I know everyone can hear me and we're ready to go. All right, let's do this. So I thought then that I just ask you a couple of questions, or you can choose to answer one of these questions. But as I said, Amy already has said the word data about 50 times already. So this is a data network. And I just wondered, what have you been thinking about when you hear the word data? Or what are you curious about? Like, why are you along here today? And what is it? What does data mean to you? All right, data bingo. Okay. Let me hear, just choose one or both of those questions to answer for me, and let me hear what you're curious about or what you've been thinking about when you hear the word data. I'd really love you to just put that in the chat so I can see what it is that the word data makes you think and feel, or maybe what some of the things that you're curious about. Okay, so how sector-wide data could be used to see what clients aren't being supported. Okay, digital information. How do I collect data? Different methods. What for? How to make it meaningful and maybe separate from KPIs. How can we ensure we're collecting quality data that helps us tell the stories of our clients? Fantastic. Recording statistics, documenting client journeys and voice. Love it. Okay, this is really great thoughts and curious questions. How do we ask the right questions? Somebody's just written outcomes. Let's talk about outcomes. What are outcomes? I've been thinking a lot about the challenges of collecting robust data when the team are focused on the person in front of them and not focused on collecting the stats. Fantastic. Yeah, really great stuff. And I think that even just by sharing those common kind of questions and things that you've been thinking about or with your team have been sharing with you about, this is a great place to start discussing these issues and really taking it back to your organization and really playing with some of these questions. And I'm sure that, well, I'm certain that no great answers might be, locked in today, but I really do hope that we're going to start looking at your thoughts and your curiosity issues, and let's really start to dive deep into this. So thank you so much. It's really lovely to see what you're thinking about, and I'm sure that if you're thinking about it, probably others in your organization are also thinking similar types of things. So there was some question in there about what is data and what are the different methods. So this is really a fundamental question that we all must understand or think about. And really data, just very, very simply, usually comes in two different types, and we call it quantitative or qualitative data. And the quant is typically numerical, or more, I call it, you can put it in a spreadsheet. And often you'll call these outputs. So these are things that are results, or they are things that you can measure with numbers. And often we use surveys or tests or certain things to collect the numbers. And we have to use statistical testing when we collect a lot of numbers or outputs through our data collection processes. But we use quantitative when we're really just testing ideas, or we want to know what people have said through check boxes, or we've observed, what have they done, what have they achieved. So we're identifying patterns, or we're identifying what people are saying about certain things. Now that can be very different to our qualitative data. Qualitative data is usually those stories or the narratives. It can include photos or drawings or other forms of data that is not just simply numbers or numerical. So we usually collect that sort of data through things like interviews and observations, focus groups, yes, drawings, film, any way that any other type of way other than numbers, really. And this is typically, sometimes it can be harder to analyze. Some people will say that, typically harder, because really what you have to do is do a lot of interpretation about what do those stories tell you, and how do you bring maybe a lot of stories together to try and find some themes of what people are telling you. So we use qualitative data to normally kind of explore questions or explore issues where we don't always have typically what we think we want to know as the answers, or we can't use a survey for it. And qualitative data obviously is a great way of giving people voice, because you're not telling them exactly what to say, or you're not giving them a survey. You're actually just telling them to share their lived experience or their stories. Now, so those are typically the two different ways, but we have a saying called mixed methods as well. And mixed methods means that you can use both types of data collection and analysis to have a look at something that you're looking at. So many people like mixed methods because it's not preferencing one type of data over another. So my question to you is, what kind of data do you typically collect right now? Is it quantitative or qualitative? What would you say is the majority of your data that you collect right now? Can you just pop it in the chat for me? I'm very interested to know. Do you think your organisation typically collects? Yeah, okay, somebody said we collect a mix of both. Good. Anybody else? Do you collect mainly quantitative or mainly qualitative, or a mix? You like to collect both? Both, mainly quant, okay, mainly quantitative. Why do you collect a certain type of data? Oh, now somebody said mainly qualitative. Another person said mainly quant. Yeah, why do you collect one type of data over another? And the reason I ask this is because often some people do say, well, one is more valuable, or one is more what we need or want, or one is what people are more used to or comfortable, or we have the processes to do this type of data over another type. Okay, somebody said because of the data we use, database we use. Okay, so databases then, yes. If you have a database, you obviously, usually, it can help you get quantitative data. Can be a little bit more tricky to sometimes collect that qualitative data. Seems that the analysis of quantitative data is easier. Yeah, well, again, it depends on what you're collecting, why you're collecting it. Quant is mostly for reporting, yes. It's often because our outputs are often numbers. How many people did you see? How many workers do you have? How many locations are you based? Often those are things that you can put in a spreadsheet or a database, and they're used to show your outputs. But sometimes the qualitative data is really trying to understand the quant. It's really saying, tell us more about why did you come and see us, or what is the outcome? What is the change that occurs because of coming to see us? Okay, I'm really loving what you're writing here. I think it's also to understand different patterns of thought, mind, belief, and habits. Brilliant. Okay, well, that's a great segue, because I wanted to just maybe tell you a couple of stories that are old stories, but they're really fascinating. Has anybody heard of Dr. John Snow? Dr. John Snow, as you can see, was in the middle to late 1800s, and he was an English doctor who was living in London, and there was a terrible outbreak of cholera in the time when he was a physician there. And he started to actually map the cases of cholera in London. And he didn't know much about cholera at the time. They didn't even really know how it was spread, but he started to actually collect some data about where the cases of cholera were found. And what happened is that just by collecting this data and being curious about the data, he started to see a pattern, that it was around a specific water pump in a place called Broad Street. And he really started to get more and more curious about why this was happening. And his curiosity led him to identify that it was potentially this water pump that was the source of the cholera in this area of London. And so he actually encouraged them to actually stop the water pump, and they stopped the water. And then he collected data to see what would happen if those households in that suburb started to not drink water from that particular water pump. And of course, cholera cases went down dramatically. And so he then identified that cholera was a waterborne disease, and they now say he is the kind of founder, if you like, of public health and epidemiology, because of what he learnt about cholera and waterborne diseases. And I just really like that story again because it's about the power of being curious and collecting different types of data, even though you're not quite sure, you know, what it's going to tell you, but believing in the power of data. Now, the other story I wanted to share with you is Florence Nightingale. Now, more of you may have heard of the name Florence Nightingale. She was around the same time in the late 1800s, early 1900s. And many of you will have heard that she was a nurse also out in the European area in London. And basically, she was a nurse, but she was also very curious about why, particularly the soldiers during the Crimean War, were getting sick and why they were dying. And she started to collect a lot of data just on various random things, really just to try and figure out what was going on. And it was her data and curiosity that led to a lot of health improvements in the way that healthcare is even today managed, including things like moving the beds further apart, you know, simple things like that, that today we kind of take for granted. But back then they had no idea that some of these things were actually contributing to death and to disease. And so I don't know if you know, but she's been now told that she's probably the first data scientist. You might have heard of that term, and they now, a lot of data scientists will say Florence Nightingale was one of the very first data scientists, and she was the first woman to ever be elected into an organisation, a membership organisation called the London Statistical Society, and she gained that membership through collecting the data and proving that data can help you improve people's lives and it can actually change practice. So I think this was really interesting stories of where people who back then didn't understand the power of data back then, but they knew that there was a reason to try and be curious. And so, of course, many more people after Dr. John Snow and Florence Nightingale have become data scientists. And you don't have to be a data scientist to understand the power of data in your own context, in your own organisation, and realise that, wow, let's see if we can be interested in what data can tell us. So yeah, that was just two stories that I really think about, and it reminds me then that when we're talking about a data culture, a lot of it is about this curiosity and reflection, this ability to be curious around what data is telling us. And for me, I don't mind whether it's quantitative or qualitative. It has to be the right data to tell us the right things that we want to know. There's no one more valuable piece of data over another. So it's really about our beliefs around what data can do and how it can help us, but then also having that curious mindset that anybody in your organization can have. But we do need to collect the data, and somebody said up there, you know, it's about process and about systems. You know, how do you collect that data and start mapping it and start exploring what it means to you? Do you have the time where your staff sit down and actually say, what are the stories telling us? You don't have to call it data all the time. You could call it the stories. You know, what are stories telling us? What are people telling us? What are we finding out from the information that we're gathering as an organization? Make it relatable to your staff and your volunteers. And, you know, being willing to learn from that data. And sometimes you might say, I'm not sure what this is telling us. Let's go and ask for some more stories, or let's go and ask for more information about that. So it's not always going to be very easy, but if you have a culture that is curious and really has a great mindset and believes in the power of data, this can really help you. What are people thinking? Is this the kind of data that you have or you would like? I'm interested right now. Where are we at right now? Do you think you have a data culture, or do we have some way to go? As an organization or as a sector, just pop it in the chat for me. I'm really curious to know, do you think that our organisations are set up to be very curious about data, or do you think we have some work to go? Okay, so somebody said we are working towards a data culture. Great, looking at something other than just meeting KPIs. Yes, because KPIs is very tedious sometimes. It's just, you know, you're reporting and you know what you need to write down. But really, when you start to be curious about that, that's when it can become very exciting. Data culture led by the department reporting. Ooh, yes. It often is led by the people who already love data or have to report on data. So how do we make sure that data culture is through every area of the organisation, every department, or part, you know, the frontline staff, the evaluation team, as well as the marketing team, as well as the, you know, accounting team. I don't know how big your organizations are and if you have discrete departments, but the point is that really the culture that you want in your organization should be across all areas of your organization with everybody. Some gaps to close. Yeah, well, hopefully maybe this is just a little way of kind of getting you to think about, would everybody say they're curious about data if I went and spoke to everybody in my organization? Now, when we then go a little bit further into this, and we've just touched on this, often the quantitative or the KPIs are around how much did we do. Those are the activities or the outputs, you know, how many people did we see, or how many times did we do X, Y, Z. Those are often quantitative, and they can be, as somebody has said, a little bit easier sometimes to collect. But when we talk about outcomes and impact, that's when we're talking about how well did we do that, and is anyone better off? Has anything changed for our stakeholders? Has anything changed for our clients, our service users, our staff, our volunteers, or our community in which we're working? And that often, the data there shows us how effectively we used our services and our programs. Efficiency is often about, well, did we manage to spend our money and our grants and our donations, etc. So really what we have to do then when we're beginning to think about a data culture is we have to say, are we asking the right questions? Are we planning to collect the right data that will give us the answers? So these are just things for you to think about. And it also perhaps helps you to reflect on, well, why are we collecting certain data? Why are we collecting quantitative data versus qualitative? Or the other way around, why are we only collecting qualitative data? Because really both are very important to help us explore both the efficiency and the effectiveness of what we do. Please, if there's any thoughts, pop them in the chat at this stage. Let me just know how this is going with you. Is there any thoughts about that? When I think about data, I think about a new language to make meaningful changes. And this comes from retraining our mind with deep listening and stillness. Oh, I really love that. Deep reflection, listening and stillness. So hard to do, isn't it? In our busy, busy world. And when we've got phones ringing, we've got things to do, we've got people to see, that can be one of the really hardest times to carve out in your day or your week, is time when you just sit and reflect and ask yourself important, curious questions. I wanted to just share a little case study with you because this was a paper that's just been put out into it's the Journal of Family Violence that I read the other week, and I thought I might just use this really quickly with you as a bit of a case study and to just explore with you again how you might use some of this data, because up until now I think we've been kind of alluding to the fact that it's your own data, and of course it can be your own data, and I encourage you to collect your own data. But it's not always your own data. There's many pieces of data out there that you can get, which is public data, or you can learn from other people collecting data. So it's not always your own data that you need to collect, or you can see what other people have been doing and then look at your own organisation and say, oh yes, we'd like to explore that more in our own organisation. So this is just an example of some work that was done by Tavensky and colleagues, who are from they are researchers, but they wanted to explore worker safety. And I thought this was, and if anybody would like this paper, just email me. I'm happy to send you this full paper so you can read it. But they asked themselves, what do workers require from their organisation and or other organisations to support them in working with fathers who use violence? That was one of their questions that they were curious about. I've actually just made another one which I think is equally as good, which is how might we improve worker safety involved in high-risk domestic and family violence and child protection cases. I love using the how might we statement because it enables you to kind of think and be curious about how might we improve something, or how might we learn more about this. But the top one is definitely the one that was used by these researchers as they went out to start to collect data. So how do you think, if this was your question, how do you think you would go and collect data about this? What would you do? What kind of data would you collect? What would you be looking for? Keen to hear from you. What kind of data, if that was a question, how might we improve worker safety? What kind of data do you think you would be going and looking for? Because this is about planning and choosing the right methodology to collect data. Okay, somebody said incident reporting. Yep, that's a good idea. Maybe that's more of a quantitative baseline, number of incidents and type of incidents. Okay, more quantitative, I would say, that is. Who else? Would anybody do anything differently? Interview, ask workers. Okay, so that's qualitative. You'd want to know and explore that, hear people's stories. Okay, somebody else has said interviews. Staff leave. Okay, staff survey. Okay, that's interesting. Again, surveys don't have to be just quantitative. You can say, tell me more, and it can be qualitative. So a survey does not mean it is always just quantitative. Levels of awareness, good. So how would you collect that? Quantitatively, with a questionnaire or with interviews. I'm interested to know this, sick leave rates. Okay, because you're sharing with each other now what kind of data might you need to plan to collect. And if you're not collecting this already, how would you go about getting that data? And if you are going to go down a certain route where you need to understand the questions to ask, or who's going to do the interviews, or who's going to put that data together, this is all part of the planning stage when you are looking at a question where you want to use data to help you explore it. So everything you've said are great ideas, right? But I want to tell you what these researchers did. They actually use something called participatory action research. there's lots of methods to collect both quant and qualitative data, and action research is a really lovely way of collecting stories and helping people reflect on things together. It's often a nice, safe way, to talk about certain issues. Now, these researchers, they engaged 65 people in this study. They were team leaders and staff from a lot of different organizations. So they weren't just looking at one organization, but again, you can do that. And they engaged them in communities of practice and focus groups. So largely getting them together in small groups and talking about the issues concerning worker safety in high-risk environments. And then they captured all of those stories, which is obviously, as you know, qualitative data, and they had to analyze it using qualitative thematic analysis is what we call it, looking for the themes about what different people's lived experience were telling them. So this is the way that they chose to do it. And it does take time, and it does take some understanding of how to take stories and look for themes and look for ideas, and being curious about what all these stories that people are telling you, what does it all mean? So I'm going to give you just the real highlights, because I'm just sort of using this as a bit of a case study with you. But again, if you'd like to read the full report, I'll send it to you. But they found generally that there were some physical safety measures that organisations could undertake and use to improve worker safety. That technology was a big issue, because perpetrators and men were using a lot more technology, and so they wanted workers to be a lot more trained around how to use technology to both keep themselves and their clients safe. Police and judiciary responses, parallel safety process, and intersectorial collaboration. So basically things from individual, organisation and sector-wide changes. These were some of the findings and some of the things that they're recommending as part of this data collection and analysis. And, these are all a wide range of things that they found from these 65 people who were sharing their stories with them. And you may feel like, wow, that's a lot of things to change, or I can't do all of that. But the point is that maybe you could do just one thing, or you could take some of these findings to your organisation or your staff in your next team meeting, and you could say, how might we do this, or how might we think about this in our organisation or our team? Is there anything that we could do similar to this that would improve how we make sure that people are feeling safe and are safe within our organisation? Now, so I'd like to hear from you. How would you use this data to improve practice in your organisation? And there are typically 5 ways that we can use data. We can learn from it. We can inform others about it. So you can share that data. You can engage people with it and actually ask them to reflect and tell you what they think. You can predict. So you can actually say, yes, we actually need to make sure that our workers are more safe, and this is how we're going to do it. And you can use it to innovate. So this might not be your data, but it might be very similar. And you might say, because of the data they've collected and the findings they found, we want to use data, we want to use these findings to do X, Y, Z. So please tell me, do you think this little study and this little paper, how would you use this to improve practice in your own organisation? Learn, inform. You can either just put the 1, 2, 3, 4, 5. You can put a number in there, or you can actually write the word. How would you use it to improve practice? I'd love you all to just think about that. Worker safety, all 5, okay. 2, inform. You could take this back and share it in your team meeting, or you could share it with your leadership team, or you could share it with your board. How else? I'm really curious. How would you use this to improve practice in your own organisation? Learn from it. 2 and 4, so inform and predict. Yeah, great. Fantastic. Inform and engage. Good. Number 1, learn. And that's if all you do is, and I don't say all, that's not quite right, but if you want to just learn from it, that's perfect, because it will make you more curious about what's going on in your own organisation. So all of your answers are good. I just am curious to know where you would start or how you think you might. But learning and inviting people to learn from this is a really, really great thing to do. What was predict? Predict is about thinking about what would happen in the future for your organisation. So you might not know a lot about worker safety in your own organisation right now because you haven't collected that data or haven't asked people about that. But you might want to say, ooh, hang on, I'm going to read that and I'm going to say, this could happen to us. So we're going to put in some practices right now to prevent people not feeling safe. In fact, I did look up this and I found out that 45% of social workers working in child protection have experienced a time when they felt unsafe in the last month. Now, you can use that to predict what might be happening in your own organisation. If the data that other people are collected, and it may not be from your organisation, but if the data is saying 45% of people are feeling unsafe, then you might say, ooh, I wonder if that is similar in my organisation. And what would I do about that right now? I don't need to go and ask people that myself. I just need to predict and make sure that I'm putting in practices to make sure people are feeling safe. All right, hope that was helpful. Okay. Engage and understand to get myself beyond the onerous bit. All right, so it's really about thinking through, what can I do with this information? What can I do with this data? Now, I'm hoping I'm going okay for time. Amy, tell me how I'm going if I need to.
Yeah,
but
no, great.
I'm going good. Okay, all
All
right.
good.
So thinking then about how we use data and if we actually use it to learn, inform, engage. I love this quote that says, numbers have an important story to tell. They rely on you to give them a clear and convincing voice. Now, I like that because I often, and anybody that's worked with me before will know, I talk about the stories behind the stats, but this is actually saying giving stats the voice, you know, because statistics don't always tell you what's going on. And if I just told you 45% of social workers feel unsafe, that doesn't tell you anything about why they feel unsafe or what they think could be done to improve their feelings of safety. So statistics are good, but we need to really use them in a way that can help us be curious and reflective. Now, many of you have heard of the word data visualization, and data visualization is simply getting those statistics or the data and putting it into a way that people can understand it a little bit better. So there are lots and lots of different kinds of charts, different data visualization methods. The software out there is becoming better and better as we're using AI to visualize data. But it is really important that you use the right data visualization. I've just done a little, if you go to data2viz.com, they give you some advice on the different types of graphs to use and whether you're trying to show over time or what different people are saying or what your statistics, there's everything. Okay, so really you need to think when you're talking about data visualization is, number one, who is your audience? Who are you trying to give your stats of voice to? Who is it speaking to? And then what do you want to achieve with your data visualization? What is it that you want for people to know or understand? And there's a whole lot in here. So I really encourage you to go away and have a bit of a read and a think about the different ways that you can visualize data. There are many software tools that can help you, depending again on what is the data that you have, who's your audience, and what do you want them to think about and learn from your data. Does anybody use any great software? Anybody really excited about any data visualization tools or software? Power BI, absolutely, that's one. What else do people use? Tableau, ooh, that's one of my favorites too. There's wonderful, wonderful software out there, and you do need to learn sometimes how to use these, but the benefits of that is really amazing. Now, once we have a decision on what is the data that we're sharing, who's the audience, and where are we going to get the best use out of sharing our data, that's when we think about how do we use data to create social value. Now, of course, we've talked about team meetings, but it can be communities of practice, alliances and networks like this one, reporting, or just training and development when you're training and developing your staff or within the sector. So this is about using data to create social value, because we don't want to really just hide our own data and just keep it to ourselves. The power of data is sharing that, which is why a lot of researchers will publish articles and reports, because they want to share that. So if you are interested in reading journal articles, and I mentioned one, it's the Journal of Family Violence, get yourself access to some of these journals that have really great articles about the data that people are collecting and the research that people are doing, and so that you can learn from that and share that. Or give it to, if somebody is studying, especially if they're studying at QUT, or they have access to a university library, ask them to bring along an article once a month to the team meeting, or every so often have a community of practice and say, let's learn from some recent research and see what we can learn. So all of these are different ways that you can actually use the power and leverage the power of data in your own organization. So I don't know why my So just a couple, I wanted to leave you today with a couple of things that you can do that really this week you could have a try of and see if it works for you. And I'm going to give you just 3 tools that might be helpful. Appreciative inquiry is a type of methodology that people collect qualitative data with. It's a wonderful little tool that I use a lot, and I can use it with individuals, with teams, with organizations. You can use it with networks. It's just a great way of being able, it's like a SWOT analysis, but they've turned it into a strength-based way of looking at a SWOT analysis. And it stands for strengths, opportunities, aspirations, and results. And thank you, Amy. She's just popped in the little link to Appreciating People, which has this little handout. And you don't have to use that, of course. You can do it in any way you like. You can use Post-it notes, or you can just whiteboard some ideas from your team, or you can do a survey. But really, it's about just gathering people's ideas about an issue, and what are the strengths, what do you do well in your organization, what are the opportunities, what are your goals around this, and what are the results? How would you know, and how would you evaluate whether your practices, your improvement practices in particular, are helping you address that solution? So does anybody use SOAR? It's just such a great little tool, and if I'm sure Amy will be really grateful if anybody else has any other handouts or tools or ways of using SOAR, please share them with the network, because it's such a great little handy way. The other one is reflection, and the most simplest for me that I've ever found is called the what, so what, now what framework. Again, I find this a really, really simple way to do it with teams about anything that you want to explore and be curious about. So what's the context? What's the data? So what does this mean? What do people think about it? How does it how does it apply to you and your organization? And then now what? So what does that mean? What could we do differently? How could we improve what we're doing? A very, very simple framework that's used with many, many people to actually use data to inform and also improve our practice. So you could take worker safety, obviously, and use that as an example where you said, well, what is the context for worker safety in our own organisation? What's our data telling us? What is other people's data telling us? So what does that mean? The implications for our organisation? And then now what? How can we improve worker safety in our own organisation? And the last one I want to share with you is the program logic approach. Many of you may already be using this. Again, it's back to activities and outputs. So what will we do based on this data and based on what we're learning about this issue? What will be the result if we put in some strategies, if we actually do some activities around worker safety, for example, and then will anyone be better off? And of course, I'm just using worker safety as an example. You put in whatever you're curious about, whatever it is the topic that you want to improve and how you want to use data. So out of those three, does anybody already use those, or does that pique anybody's interest in how to immediately this week in your next team meeting use a little framework to think about how do we use data to improve practice? Please just pop it in the chat. And if any more information is needed, please let me know. We have program logics, but I'm excited to use SAW. Yes, excellent. 3-step approach. What, so what, now what? So brilliant, easy. Your team will love it, I assure you. Yeah, we don't want to, I suppose, one of my key thoughts is here, don't overcomplicate things for your team, especially those who are a little bit scared of data, a little bit curious about, oh, what does this mean for me? Don't overcomplicate things. Don't make it too heavy for people because they'll be switched off. It's really about taking people on this journey and getting them excited about data and what it might tell them and how it can help them in their practice. The 3 things I want to leave you with is learn. Think about, what do I need to know more about? More webinars. Throw the topic ideas at Amy, or go and have a look at some of the webinars that are already out there that Amy's been collating, because there's fantastic webinars that might give you some ideas about what you need to learn about. Play. Go and find out what all the software is or what the different ways of data visualization is. There's a heap of things out there that you can play and sort of find out what's going to be most useful and valuable to us. And then discuss with your team, how is it going to be most useful to show the data to them? Even if it's qualitative, what do they need to know from qualitative stories and narratives and pictures and film, etc. So learn, play, discuss. That's how you really build a good culture. So my key points, and as I'm going through this, I would love you to think about your key takeaways today. Let's share that with each other. But what I'd love you to think about ongoing here is collect the right data. You don't want to waste time and resources because you don't have that time, and people will just be switched off and they'll say it's all too overwhelming and I don't understand it. So just plan ahead. What is the right data? Use visuals and stories to help people just start being curious about what is the data telling us. Use a range of data to help you improve practice. It doesn't have to be just your data. It can be there's lots of other data out there that you can start to get people excited about data. Find the time to review and reflect, and that's really hard, I know, in your busy day and your busy week, but it's that reflection time that is really going to help you think about how valuable data is, help people use the data to make decisions. That's how we become data driven, because now we're making decisions based on what the data is telling us. And encourage data literacy, which means everyone uses data and learns how it supports them. Those are my sort of key tips for this journey that you're going on, using data valuably and using it to improve your practice. But most importantly, we want better outcomes for our community, for the people that we work with. And I really believe that if we have this data culture, great outcomes are going to happen, and really good things will happen. So that's it for me. Please just share, what are your takeaways today? Where do you think this sort of fundamental discussion is going to take you? What are the key things? Love you all to share one or two things. Please also connect with me on LinkedIn. That's the best place to connect with me. I'm always sharing things on LinkedIn about data that I read or things that I'm curious about. I try to do that just to stimulate some interest and some discussion, so please connect with me on LinkedIn. And yeah, I hope that's been a helpful discussion to get you all thinking at this beginning of this network. Thanks. Somebody has shared, how will I build a data culture that is engaging opposed to onerous? Fantastic question. Start small, start with some really easy things that get people excited and curious. Taking the time to plan, yeah, doesn't always feel, you know, you've got to sometimes really put it in your diary, make that time to plan, but also to collect, analyze and reflect, that whole full circle. Yeah, fantastic. Thanks for sharing.
Thank you so much, Ruth. I think we've got a few more slides to go through, so and we'll take questions and answers as well at the end. If there's follow-ups as well, we're happy to link you in and address some of those questions again at the end too. So I'll just continue to share my slides again. Hopefully you can see that now.
Yeah, and please, people, keep putting in a little bit about your takeaways. I think it's a really helpful way of sharing with the network, you know, what you're doing and what you're thinking about. Thank you.
Oh, thank you so much, Ruth. Oh, thank you for being generous with your time and sharing your knowledge and expertise with us today. It's been really a pleasure coordinating this webinar with you, and I always enjoy listening and learning and connecting with you, and your excitement about data. You always make me excited as well, so thank you so much. What I thought we'd do now is also just talk about the next steps for the network and some resources and supports that will become available for the DFSV service sector. And then, like I mentioned, hopefully we do have some time for some Q&A after that. If you're happy to stay around, Ruth, for the next kind of 10 minutes or so, that would be wonderful. Otherwise, we can take them offline as well. So I just also thought we'd mention in terms of resources, we'll offer DFSV, the Data Insights Network members, an opportunity to participate in an online forum. And so participation is encouraged but not required. The forum is hosted on Microsoft Teams platform to aid communication and collaboration. And that's kind of like outside of the webinars as well. So anyone using the platform, the Teams platform channel for communication would agree to uphold the DFSV Data Insights Network guiding values and code of conduct, as well as alignment to the intent and purpose of the network while we're engaging on the platform. And QCOS will maintain the channel and will endeavour to address any issues in a timely manner. In terms of the plan going ahead for the network, this slide maps out the next webinar topic ideas, however noting that this is in draft and it may change. So our intention for the network is to be really responsive to the needs identified by DFSV services. And so I mentioned with the approach in earlier slides, the idea is really to work as a two-way learning where DFSV services can share current practices and processes on how you use data to improve outcomes for your clients, as well as QCOS and our guest speakers sharing resources and data capability uplift strategies, ideas and tips like we've shared today back to DFSV services and the network. So the topic ideas we've got listed today, so obviously today's session on what is the value of data and how it can improve practice. And then we're planning ones for what are we learning about DFSV through data, as well as some other focus topics. So what is the value of data and how it can improve Queensland government's workings. We're going to look at what is a data strategy and data governance framework, as well as data quality strategy and DFSV data standards, impacts and outcomes for DFSV services, as well as understanding data maturity and data action strategy plans. And again, kind of revisiting, that CQI kind of process and going back and forth around then what are we thinking about, what are we learning about DFSV through data again, as well as revisiting those data strategy action plans. And then also we've put down some deep dives into sector specific examples. So for example, temporary supported accommodation services, we may have a focus on those, or domestic violence counselling services, sexual violence counselling services, or children's domestic violence counselling services, just as examples. So again, really happy to connect with the DFSV services sector and hear your thoughts on this plan for the draft for the network. In terms of also other uplift activities and supports, so there are approximately, like I mentioned, 126 WSVP funded DFSV services in Queensland. So in addition to the network, which is available to everyone, QCOS is also funded to provide additional uplift data capability supports for up to 20 DFSV funded services. And so these activities may and supports may look like facilitating a conversation to identify your data vision for your service, and kind of starting to build that data-driven culture, and identify key activities and goals to work towards achieving you or your organization's vision, looking at like a baseline of where you or your organization may be positioned within a data capability assessment matrix, and supporting your service to create a data strategy action plan and document key activities and changes to achieve your vision, and to support the implementation and uptake of DFSV data resources. And with your service, developing an understanding of different data maturity frameworks and tools that may support you to achieve you or your organization's data vision, and drawing on the tools and frameworks identified. So just to note as well, sector uptake of the DFSV data capability uplift activities will be monitored and supported, but compliance with embedding any data strategy or change within your organisation is outside the scope of QCOS's support. And we've also made available, or will be shortly making available, a DFSV Data Insights website, so where you can find out more about DFSV Data Insights initiative, express your interest to join the network, as well as links to access data supports and resources. And resources will be progressively made available on a DFSV Data Insights community door page as well, including webinar recordings. So I'll just share some links with you now in the chat so you can, it includes our contact details on how to connect with us, and these resources that we're sharing with you today and that will be available. So that's a long list for you to go through in the chat. So just in terms as well, lastly, in addition to the one-on-one supports, QCOS can also develop potentially some of the following resources. So a data capability assessment matrix, a data strategy action plan or template, an upskilling strategy or data analytics, and a data strategy and culture prompt guide, a guide for managers to speak to their teams about the DFSV Data Insights Initiative, potentially a one-page summary on WSVP Data Insights Roadmap products, and fact sheets such as what are we learning about DFSV through data, as well as what I've already mentioned about the website to access and request support, and as well as the community door page where you'll be able to access webinar recordings as well. So feel free to explore those resources, and we'll share more of them as they become available. And so additional resources may be required. Again, it's kind of an iterative approach, so really identifying the needs of the sector and what supports we can provide, including training materials and onboarding plans for new staff, or a guide on collecting data from the service user, and draft policies and procedures for the not-for-profit organisations, and as well as a Q&A fact sheet or a data quality checklist. So that's all from us in terms of the content of today. I have already shared our email, which is dfsvdatainsights@qcos.org.au. So please reach out to our team if you have any questions about the new network. And again, a big thank you to Ruth for being so generous with your time today. And we really appreciate your enthusiasm and coming back to present for QCOS again. So I'll stop recording now, but please feel free. We've got 5 minutes if you'd like to stay online. We also have a Mentimeter as well to kind of do a bit of a survey at the end to hear how you feel about today's session, and we'd love your feedback given that we're a new network and there's always room to improve. So again, thanks everyone for staying online today and joining with us in today's discussion. I'll just change the settings so that we stop recording, and we feel free. We're happy to take questions when I work out how to stop recording. Great, I think that's